Could it be possible that COVID separated us on a greater deal than just being locked up at home? Has it created an invisible shield between all human beings? And does that shield still remain in place? And most importantly, how are we functioning differently now compared to what we were before COVID? We also have a new complex health challenge that has emerged. Long COVID. Everybody likes a good conspiracy theory, right? I actually found a few of these related to COVID-19. Any of them true? I don't know. Let me know if you have any of those tweaks in post-COVID behaviors. Psychologists reported the biggest surge in patients with anxiety disorders, 79% increase since the start of the pandemic as of 2022. It transferred social connection, making it possible, but often leaving us with a feeling of Zoom fatigue. Have you ever had this feeling? I'm just trying to bring some kind of value to you, and maybe it'll give you some fresh perspective. Welcome back to the Paradox Experience podcast. I hope you are all well and healthy. In today's episode, I wanted to touch base on something we all went through just a few short years ago. An event that didn't just affect one country or one group of people, it affected all of us. It truly was a paradox of an experience. It bothered me a lot for a long time. And finally, I have a platform where I can spill it all out. And I want you to tell me your experiences too, please. So do me a favor, watch this episode and then spill it all out in the comment section too. This is the place. This is where you can, spill and talk about your experiences with this. And I'm sure it affected you in some way. I'm talking, of course, about the COVID-19 pandemic. It feels like a lifetime ago, and yet the scars are still fresh. A lot of people were separated. A lot of people were upset, getting fat at home, eating because what else can you do? And millions struggled every day just to live their normal lives. We all wore masks. We weren't allowed into certain places without the so-called vaccine passports and all that bollocks. Here's the question that's been nagging at me, and why the idea for this episode, which is also inspired by my previous one, the one that makes this a paradox experience. Could it be possible that COVID separated us on a greater deal than just being locked up at home? Has it created an invisible shield between all human beings? And does that shield still remain in place? And most importantly, how are we functioning differently now compared to what we were before COVID? In my previous episode, I spoke about left and right, political polarization and constant divide between people and how we can tackle this problem in the modern world. And then I started thinking about COVID and how it might be a piece of a puzzle to this global divide. Honestly, I didn't know how to tackle this subject. I had no idea. It took me a while. I had to start digging deep into my memory of how it all began and then progress to what it has become. I'm one of the few who had a slightly different experience. I worked through the entire time, right? As it was considered one of the necessary industries. So my day-to-day work life wasn't that much affected, but my girlfriend, my wife now, at the time, she was stuck at home, just like millions and millions of other people around the world. And watching her and others go through that isolation, the fear, the sheer boredom, that's where my research for this episode began. Just started thinking about what was like for others. Because to be fair, it didn't really affect me that much when I think about it. But I've heard so many stories from so many people, and even my family members who were deeply affected by it, mentally, health-wise. And I just wanted to touch base on this and see what are your experiences with that as well. If I could humbly ask for anything right now, it would be to ask all of you, dear viewers, to subscribe to the channel, like and comment. Without you, what I'm doing won't make much difference. My promise is to make every episode bigger and better. It's to make sure you get the best possible reviews, interesting information, paradoxes, obviously, and knowledge you couldn't possibly get it anywhere else. So please, click that subscribe button and leave a like. It only takes 2 seconds, but it means a lot to me because it lets me know that I'm doing something valuable for you. Thank you, and back to the podcast. So let's start with the most personal and perhaps the most lasting impact: mental health and well-being. Before COVID, mental health issues were certainly present. Of course they were. They operated within a known framework of existing social structures and coping mechanisms. You saw your therapist, you went to support groups, you met friends for coffee. Then came the new normal, and with it, a rapid shift. Statistically, change is stark. The American Psychological Association noted that surveys show a significant increase in reported symptoms of anxiety, depression, insomnia, and stress across various age groups. Yeah, I'll just read it for you quickly so you can see for yourself as well what I am talking about. So the summary of the American Psychological Association (APA) findings on the increase in mental health symptoms during the COVID-19 pandemic, based on surveys of practicing psychologists. Anxiety and depression. Psychologists reported the biggest surge in patients with anxiety disorders, 79% increase since the start of the pandemic as of 2022. Global European increase. The WHO reported a 25% global increase in the prevalence of anxiety and depression in the first year of the pandemic, with European studies confirming a significant rise. For example, Belgium, the prevalence of anxiety and depression doubled in early 2020. Italy, 42.2% of people surveyed during the lockdown reported sleep disturbances. Most affected groups, ages 15-24, and that doubled in most European countries. Mental health service issue initially declined, suggesting the pandemic increased the existing gap in access to a mental health specialist. Yeah, that just basically tells us what was happening when we put everything down into a numbers and percentages. So this wasn't just temporary. Isolation from the lockdowns, the constant fear of the virus, the non-stop news cycles, it all contributed to what is essentially a collective trauma. There is a lingering sense of vulnerability now. We truly know, how quickly things can be taken away. Just like that. But where this shield is most visible, most crushing, is with our youth. So studies around the world, including from the UK's Royal College of Psychiatrists, have pointed to pronounced negative effects on youth mental health, with referrals for mental health services for young people hitting record highs, which is among the statistics I just read. You add social media to the mix, and we have a pretty nasty cocktail of anxiety, fear, separation, and trauma. They missed crucial social periods, major life events, and had to navigate their most formative years behind a screen and a mask. It's not just a before and after picture. It's a before and damaged picture for many. We're still dealing with the fallout of that sustained high stress period. We learned to fear the air we breathe and the people we love. That's a tough habit to break, right? Tell me about your own experience in the comments. How was it for you to come back to a normal life after COVID? I'm very curious to hear from you. Moving on from the psychological, let's talk about the practical and economic, work and economic life. This is where the world didn't just change, it was utterly accelerated. Before COVID, the traditional office, the fixed 9 to 5, the routine commute, that was the bedrock for millions in white-collar professions. It was taken for granted. And now, well, we're living through the age of remote and hybrid work, although it seems to be changing with the AI and push from the employers asking employees to return to the offices. This massive instantaneous shift has permanently changed the workplace landscape. For some, it's a beautiful thing, greater flexibility, more time with family, no commute. But for others, it's blurred the line between work and home to the point of extinction, making it feel like you're always on. This work revolution also brought about what's been called the Great Resignation. People had a quiet moment in their homes to reevaluate what was important. They prioritized work-life balance, questioned their career paths, and simply said, no, not for this pay and not for this stress. And this is what I talked about in another one of my episodes about generational divide and how, for example, Gen Z is taking more life balanced approach to work. The labor market is still reeling from that profound reassessment of value and worth. But here's the paradox of this shift. Economic inequality was severely damaged. While many of us could work from a comfy home office, a vulnerable populations and lower income workers, the essential workers, the frontline staff were disproportionately affected by job losses and higher health risks. The pandemic didn't create inequality, but it certainly shone a spotlight on it and made it worse. You're talking about inequality in the workplace? Well, COVID is a major factor for that. And now we are heading towards another work inequality obstacle. Yes, an AI. And finally, on the economic front, awareness of supply chain resilience is forever changed. Those empty shelves, that's what happens when a global system is too fragile. Now there's a heightened focus on increasing local or regional production. Nobody wants to be caught flat-footed again. That is probably good, but now imagine again those big supermarkets go to shit. We are doomed. Well, at least people living in the cities. That's why there are more and more people talking about moving out to a countryside, somewhere where they can grow their own plants and vegetables, breed chickens or whatever else they want to do. And that's what I've heard from many people when I watch them online, or even from the people that I've spoke with. They're not really happy living in the big cities anymore. So maybe COVID is one of the reasons. Maybe. I don't know. But that's the reality. Since the pandemic, we live in the uncertain times. We're past it now, but the effect it has left on our lives, economic and social world is gigantic, and it's not going to go away. The third major pillar of change is how we interact. So social interaction and community. Before we took in-person gatherings, a friendly handshake, and crowded spaces completely for granted. Now there is a pause, a moment of consideration before we step too close. I still have a tendency to wash my hands more often and be more sterile, or try not to touch the door handles with a full grip. This is one of the after COVID effects. Let me know in the comments if you have any of those tweaks and post-COVID behaviors. Like that's the invisible shield at work. Our social lives were instantly digitized. Digital connection became central. Video calls for work meetings, for family birthdays, or for pop quizzes, whatever. It transferred social connection, making it possible, but often leaving us with a feeling of Zoom fatigue. Have you ever had this feeling? Because I did. This led to fundamental alterations in shifting social norms. Personal space suddenly expanded. Hand hygiene became an obsession, and probably for the better. But some people got germophobic so bad that they won't touch anything without applying a hand gel sanitizer straight after. And of course, mask wearing, which became a cultural battleground with varying levels of adoption and controversy. Like, you have people that would wear masks halfway through, or they wouldn't cover their nose, or they would have them, down around their neck or whatever, and then people would get angry and call them out names and stuff like that. It was huge chaos from what I remember. That's why I didn't really even want to go out and be, among other people, just so I wouldn't get, I don't know, abused for wearing my mask the wrong way, because I hated it. I absolutely hated it. I hated to wear a mask because it was so uncomfortable, and I just hated it. So I can't even imagine how all these doctors and nurses who are stuck in hospitals for months and years with, with those masks constantly covering their mouth and nose. I honestly, I don't know how they coped. I'm so impressed, and I'm so grateful, and I'm so honored that there are people out there who, um, you know, sacrifice their lives, health, families, even to be able to help other people. Whether you agree with them or not, these are all new variables in the human equation. But here's the flicker of light in this social paradox. There's been a re-evaluation of community. Reports indicate an increased appreciation for local communities, the people in your apartment building, your immediate neighbors, and absolutely the essential workers who kept the lights on, the shelves stocked, and the hospitals running, which what I just said about doctors and nurses. We learned that the global is connected, but the local is vital. And this might be part of the equation why we have drifted away from each other more so than before pandemic. And this is also what I talked about in my previous episode of Paradox Experience. Local communities can bring us closer together again, hopefully. I don't know. Everybody likes a good conspiracy theory, right? I actually found a few of these related to COVID-19. Any of them true? I don't know, but most of them are probably false. Who knows? I'm going to read them out to you. And there's like a lot of different conspiracy theories from what I remember. So I'm just going to give you a quick one because I actually wrote it down here. Right, there you go. So one of them is origin of the virus. So lab leak bioweapon theory. So the most prominent one is the claim that the virus was engineered as a bioweapon or accidentally escaped from a laboratory, most often the Wuhan Institute of Virology in China. Intentional creation for profit control. The claim that the virus was intentionally created and released by a group, example, world elites, Bill Gates, or governments, to implement a global Great Reset or population control scheme, profit from the subsequent sale of vaccines and treatments. Another one is vaccine-related theories. Once vaccines became available, a significant wave of misinformation centered on their safety and purpose. Okay, so one of them were microchips and tracking. It seems like it is false, but who knows, right? The false claim that COVID-19 vaccines contain microchips or nanotechnology intended to track or control the population. The DNA genetic change. The myth that the mRNA vaccines can alter a person's DNA or genetic code. What do you think? Causing infertility or cancer. That was another interesting one. Most likely false claims that the vaccines cause long-term health issues like infertility, cancer, or autoimmune diseases. Although I had an aunt who took 2 jabs and started to have blood circulation problems. I know that for a fact. That's what I experienced myself. Swollen legs and arms. Or my uncle started to have heart issues after getting the jabs, after 2 jabs, I think. And he's still, not fully back to, he will never be fully healthy back again. But yeah, I don't know. Maybe it was caused by something else. I have no idea. But that's what happens right after you get the jabs. Poison depopulation tool. That's another one. Another one. The extreme claim that the vaccines are an instrument of mass sterilization or depopulation designed by shadowy global organizations. And the third one is false causes and cures. These theories offered alternative, non-scientific explanations for the virus's spread of or promoted unproven treatments like 5G network connection, the well again baseless claim that the virus was caused by or spread through the activation of 5G mobile networks, but I've heard about those before, and false cures. Widespread promotion of unproven or sometimes dangerous substances as cures or preventatives for COVID-19, such as ivermectin, hydroxychloroquine. I'm not sure if I pronounced that correctly, or even household chemicals. Yeah, so those few were that I found. One of the conspiracy theories about COVID-19. So I'm not sure if you believe in any of them, but if you do, again, let me know in the comments. I'm actually very curious to hear what you think about all of that. So finally, let's wrap up by looking at health and healthcare, because this is where the vulnerability was made utterly real. Before healthcare was a critical but often fragmented system, infectious disease risk felt remote in many developed nations. Something that happened over there post COVID. I mean, we've seen a revolution. The telehealth boom rapidly adopted telemedicine, making healthcare access much easier for many, although we must acknowledge it highlighted the digital divide for those without reliable internet access. And there are still many places in the world with no access to healthcare, let alone and access to the internet. And to be fair, all those options that you actually could ring a doctor and tell them your symptoms and ask them what to do, and they would give you prescriptions over the phone and all that. That's bunch of crap. Like how can you treat someone over the phone? And that's what I never understood about some of the doctors as well, where you couldn't actually come in, you know, even at certain distance or whatever. I don't know, like, but like they should come up with something else to be able for, especially kids, right? If you're an adult, I think you can go over all those problems and issues which are health. If you have a flu or whatever, I'm not talking about like any more serious health issues, but especially with the kids, if a children is sick, you as a parent should be able to go in and see a doctor, not just be calling up the phone and just, trying to get some kind of, you know, prescription or diagnosis from a doctor. But anyway, it was what it was. So there is now a heightened health awareness globally, right? The focus on public health and infectious disease preparedness is massive. Like governments and institutions are thinking about the next one, and the world is generally more attuned to personal health signals. Have you ever saw a post on social media about another risky COVID-19 variant, risky, dangerous, etc.? Like most of those in the comments are laughing, not taking it seriously because people are more attuned for a propaganda and not being sure what's real and what's fake news. I could be spreading propaganda, and you would have to you would have to assess if what I'm saying is true or not. Can you? I'm just talking here because I wanted to spill out all of the things that I have experienced and my thoughts about COVID and how it affected me, my close ones, my family. And I'm just curious how it affected you. So don't worry, I'm not trying to spread any propaganda over here or, talk crap basically. I'm just trying to bring some kind of value to you, and maybe it'll give you some fresh perspective on this whole COVID-19 topic, because I actually haven't realized it before, but since I started to think about recording this episode, it was a kind of a burden relief Like there was something sitting inside of me, and now that I'm talking about it, I just feel a bit better. Because I've never done it. I've never talked about it before, even to my close ones. We also have a new complex health challenge that has emerged: long COVID. This is creating long-term disability and an economic burden that we are only just beginning to calculate. And perhaps most importantly, the pandemic shone a bright light in systemic health disparities across racial and socioeconomic groups, proving that vulnerability is not shared equally. The COVID-19 pandemic acted as a powerful global accelerator of change and a stress test for every human institution. The after is marked by a pervasive sense of uncertainty and vigilance that was largely absent before, coupled with massive technological acceleration in areas like remote work and healthcare. Many of the changes are a blend of both negative consequences, the mental health crisis, economic disparity, and potential long-term benefits, greater work flexibility, emphasis on public health. So the invisible shield that I was talking about is real. It's the slight pause before you shake a hand, the instinct to grab sanitizer, the blurred boundary between your couch and your desk. But maybe, just maybe, this shared trauma has also given us a shared vocabulary for vulnerability, a deeper appreciation for our local community, and flexibility to truly live a different, more balanced life. I'm just trying to find some positives in all this. And as always, what we are looking for. It's paradox, isn't it? The event that physically separated us may have ultimately accelerated changes that could, in time, improve our lives. But who knows? I'm just a guy talking here again, don't know. Anyway, it was nice to finally let all of that out in the open. That's the thought I'm going to leave you with this week. So thank you for joining me on the Paradox Experience podcast. As always, I very much appreciate it. If this episode resonated with you, and I hope it did, let me know your personal paradox from the pandemic. So please don't forget to subscribe, like, and comment. I hope you stay well, stay healthy, and I'll catch you next time. See you.